Two for the Honorable Lourdes A. Leon Guerrero Magahagan Guahan, Governor of Guam. Manana Jesus, and welcome to the office of the Governor of Guam. We are delighted to have you here with us on this beautiful Friday morning, Biba Betness, to proclaim November 2025 as Home Care, Hospice, and Palliative Care Month. Before we begin, of course, I want to recognize and introduce our top nurse for the island, the Honorable Lourdes A. Leon Guerrero, Governor of Guam. Let's give a round of applause. I also want to recognize the FHP Home Health Hospice team, starting with Administrator Lisa Mesa. Half a day, Lisa, Miss Lisa, yes. Manana Jesus, Donita Newcomb, HSP Medical Clerk. Also want to recognize Maria Teresa Glotan, Registered Nurse. Ruth Gorosame, Clinical Manager and Owner. Joy Henson. Let's give these ladies a round of applause. Thank you so much. Administrative Clinical Manager, Faye Gorosame, HR Manager. Also want to recognize former Mayor of Dedidoshi, Goinor, Melissa Savares. We're keeping her busy. Yes, keeping her busy. Miriam Edomai, President for Title III Advisory Council. Let's give her a round of applause. Barbara Anage, member of the Advisory Council. Let's give them a round of applause. I also want to welcome our FHP Home Health Hospice team. Raise your hand. Actually, they have these beautiful shirts, Governor. I think we should adopt them at GovGuam. It's their Fiesta Friday shirts. Art, can you stand up and model your shirt? This is their Friday shirt. I vote in favor of adopting something like that for the Office of the Governor of Guam. But that's your FHP Home Health Hospice team. They're wearing those beautiful shirts today. And I also want to welcome and give them a round of applause, the Guam visiting nurses. These are Smasi for all that you do. And further ado, I'm going to give the floor now to Donita Newcomb, Medical Clerk, Health Services of the Pacific, for opening remarks.
Good morning, Governor Leon Guerrero, Senator Ada, and everyone who took time out of their busy schedule to be here today. My name is Donita Newcomb. I work at Health Services of the Pacific. Today, we officially recognize November 2025 as National Home Health Care and Hospice Month to honor the professionals who provided compassionate, life-enhancing care in patients' homes and in hospice settings. So, why November was the chosen month? Historically, in 1983, President Reagan proclaimed November as the month to recognize home health care and hospice workers, thus creating a national tradition. This the season of reflection, November, with its themes of gratitude and family gatherings, is seen as fitting time to highlight the dignity, comfort, and compassion that home health and hospice care brings to patients and their families. November is a good time to continue to provide awareness and education through local and national activities such as proclamation events that show support for care in home settings. 2025's theme is One Voice for Care at Home. One Voice for Care at Home is about coming together as a unified movement to celebrate, advocate, and expand awareness of home-based care. One Voice for Care at Home underscores that while caregivers come from many backgrounds, they share a single mission, ensuring dignity, comfort, and quality of life for people wherever they call home. One Voice for Care brings unity across the field of home health, hospice, palliative care, private duty care, and provider home based under one collective message. One Voice for Care creates advocacy through a unified voice to policymakers, communities, and administrators who make home-based care possible. One Voice for Care recognizes the health professionals in this room and beyond our walls, our nurses, aides, therapists, social workers, physicians, mid-level practitioners, and office staff that support what we do. We thank the governor, senators, and the community for hosting this proclamation event. This event continues to raise awareness of the work we do and celebrate healthcare professionals, caregivers, and patients receiving home health and hospice care. With one voice, we will continue to unite, advocate, and celebrate home health, hospice, palliative care, private duty, and provider home base in Guam. Thank you.
Thank you so much, Donita. I now want to give the floor to our governor, the Honorable Lourdes A. Leon Guerrero.
Thank you very much. Thank you for those comments, Donita. It's so right on point what you said, everything about home health, bringing care to the home. And I think homes are very private to a lot of people, right? And you being part of that private family life of someone who's going through, the time of the end of their lives together with the families is, I think, such a great uh, welcoming and privileged families give to all of you to be part of that. As a nurse, I definitely am very sensitive and very understanding to uh, the whole continuum of life from birth to death. And for me, if we can make that journey through death much more comfortable and peaceful and calm to our people and to our families, that's a job of great noble and of great professionalism, and I think of very great excellent care. And I know that the many, many people that work home health care, hospice, and so forth, their work continues to just be that very professional, very calming, very nurturing, I think. My mother was in hospice, and I'm a nurse and I know stuff, but I'll tell you, I rely on the home health nurse, the HSB hospice nurse, that come to my mom's house because they're the experts. They know exactly what to do. I mean, they know from when, hey, when if your mom's in her last few days of life, this is what you need to do. This is how you need to make her comfortable. You'll start seeing these kinds of changes with her respirations, her mental, all of that preparing, right, the families to be part of that. But no matter, of course, how much preparation you have, when you see your loved one take their last breath, it's just pain and grief throughout at that moment. But you make that a little bit more easier to deal with and to accept. So I just want to say the work that you do is so very much rewarding, not just, I believe, to yourselves, but to our family and our community. And to have this hospice program going and to have home health going is very important in the whole healthcare delivery system. I know Ruth was very instrumental in getting it going. As senator, I passed the law that allows a nurse to declare death at the home without having, one of the biggest and I know people do their job right, but one of the biggest inconvenience is when our loved one passed away and we have to call the ambulance and the police comes in and starts investigating. I mean, that just, I think, just makes the grief even harder. So the bill that allows the nurse then to declare death doesn't then need the investigation and all of that, because the nurse who has the expertise, the knowledge, the clinical experience to make that assessment is very crucial to that whole process. So whatever we can do, and in your talk you talk about us also being advocates to policy leaders to try and change policies for the interests of our people staying at home, going through this journey is very, very important. I think policy leaders need to make it as much comfortable and as peaceful for our people in their homes. So I just want to say congratulations. I just want to say I have great respect for all of you, and I thoroughly admire the work that you do. It's something very important on our continuum of life spectrum. So I just want to recognize that, and of course proclaiming this month, November, as the month for home care, hospice, palliative care is very honorable for me to do. And your description of November, right? And then I'm thinking, well, I was born in November, so it must be also a very important month. Anyway, I just want to say thank you. And on behalf of the people of Guam, we recognize and acknowledge, and from a very grateful and appreciative community, thank you, and Sizus Masi, and congratulations on this month.
Sizus Masi, Governor. I'm now going to hand over the microphone to Maria Teresa Gloton, registered nurse for HSP, for the reading of the proclamation.
Proclamation number -118. A proclamation of the Governor proclaiming November 2025 as Home Care, Hospice, and Palliative Care Month. Whereas this November, our island joins the nation in observation of Home Care, Hospice, and Palliative Care Month to honor the countless individuals who provide vital services to the aged, disabled, or ill, and to celebrate the lives of our loved ones receiving compassionate care. Whereas this year's theme, One Voice for Care at Home, highlights the volunteers and many others play in ensuring that quality health care and comfort are delivered to individuals in the safety and dignity of their homes. Whereas our disabled, elderly, and ill loved ones deserve special, compassionate care to help them live with comfort, independence, and the highest possible quality of life. And whereas the men and women who provide home care, hospice, and palliative care represent the spirit of community, offering comfort to patients and peace of mind to families through their skill, dedication, and empathy. Thank you.
Now therefore I, Lourdes A. Leon Guerrero, Magahagan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim November 2025 as Home Care, Hospice, and Palliative Care Month. In witness whereof, and together with the Segundo Magalahinguahan, Lieutenant Governor of Guam, Josh Tenorio, we have caused the Great Seal of Guam to be affixed in the capital city of Agatna on this 21st day of November in the year of our Lord, Anno Domini 2025. Congratulations, and Biba!
Biba, November 2025 is Home Care, Hospice, and Palliative Care Month. Before we conclude, I do want to invite everyone to the front for a group photo. All our ladies and our gentlemen here, please join us in the front. Jose, our photographer, will take our group photo to memorialize today's event. And if you had friends and colleagues who were not able to join us, this event was live streamed on Governor's YouTube page. That's Governor Leon Guerrero's YouTube page. So if you have friends and colleagues who were not able to join us, you can have them log on to YouTube. The event was live streamed there. Again, Sizus Masi for joining us here at the Office of the Governor, and thank you for all the compassionate work you do.